And we are live. Welcome everybody to Lubbock Compact Live for Wednesday, May the 24th. I am your host, Adam Hernandez, here with my co-host, Joshua Shankles. And we have a great guest with us today. And she's been on the show before, if I'm not mistaken. It was long ago. So this is her second friend of the show, for sure, and friend of the city. Katherine Wells, our public health director, is here, and she's here to talk about some new programs that are in her department, update us on the state of the city's public health situation, and a lot more. So as usual, during the show, we will be able to answer your comments live. So if you have any questions for Ms. Wells, this is your time to get them in. So this is a rare opportunity. I mean, she speaks all over the place, but this is a rare opportunity to get some online questions answered live with Ms. Katherine Wells. And thank you so much for joining us, Ms. Wells. How are you tonight?
I am great. My camera froze up there a minute, but I think I'm on my Wi-Fi at home. Usually do these streaming from work, but 7 o'clock, I decided that I better get home to the kids and my husband. But thank you all for having me tonight. Really appreciate it. Yeah, I think it was about a year or maybe even more than a year that I was here. I mean, the last 3 years for me are a blur.
Yeah. I know, right?
I don't remember. I can't put together the dates. It was sometime during COVID I came and spoke with you guys.
Let's do it on at least an annual basis, shall we?
Okay, and let's talk about other things besides COVID.
Yeah.
Right.
So, actually, I know you want to talk about this program, but I actually, because, like we were saying before the show, we know what an asset we have in you in our public health department in general. We are such huge fans of your work. We think that that is going to leave a legacy in our city that will be so huge, and just once again, thank you for everything that you've done before, how you've led this department, all that. And so even before we're able to get into some things, what I want to ask is, can you give us a look inside your mind a little bit and tell us, like, how is it that you define public health and like human health in general? I want to know how it is that you conceive of like what this is and how that informs your work. Could we start there?
That's a big philosophical question.
I know,
Josh.
but I think it'll be really interesting. I want to get a look inside your mind, if you don't mind.
Okay, well, for me, and probably have a different approach than we've ever had in the public health department before in Lubbock, but I really see public health as being the convener of all of these different organizations throughout our community that do things to improve health. And I take it as much broader. It's not just what happens between you and a doctor or you and the pharmacist. Health is, safe communities. It's, strong schools. It's access to care. It's being able to have, an ambulance pick you up when you call 911. It is, it's so many different things. It's, that community, mental health, all of that is intertwined. And I see the role of a health department in a community like Lubbock to be the convener, the ones to bring all those different partners to the table, and let's figure out how to utilize all the awesome assets we have in the community really to move us forward. Like, how do we, extend the length of life over the whole community so that everybody has the ability, to live a long, healthy life. Does that answer your question?
No, I have so much I want to get into. I know I don't want to suck up all our time on this. Adam, do you want to respond to that?
I think that's amazing to hear you actually say that. I don't think I've ever heard you kind of talk about that before. So that's a great question, Josh. But I mean, it makes a whole lot of sense. When I think about your impact here, Katherine, it's just been enormous. Sorry?
No, the dog started barking. I'm sorry.
Yeah. No, your impact has been so huge here, and going to grow. I've kind of witnessed you work a little bit just from kind of snapshots here and there of things I've seen or heard about or that you all have let us know about. And the way that you go about your work is in a similar way how we go about our work. So we were like, yes, she gets it. You have to like get everybody to collaborate and all these things. But then you're like such a workhorse doing these things. And it's just, it's so necessary and it's such a blessing to the city. And so it just makes so much sense to hear you talk about how you're informed about doing the work you do. I just think it's amazing. So
yeah, if you'll forbear me just 1 minute to also respond to that. It's like, you know, what is public health? Well, it's like, what does it take to create the conditions under which humans can thrive? And as you say, that touches almost every dimension of human life. And also it's so resonant with us in our work because it's like, well, what does it take to make a healthy city and healthy communities? It's a city is very much kind of like a living organism in its own right. And it has a very great level of dynamism, and there's a lot of disparate entities working, you know, a lot of different intersections between those. And so, yeah, like seeing somebody that is able to slip this frame that is clarifying around an issue that is like, let's look at this through the lens of public health, makes so much sense. And also this notion of networking people together, I think, is just completely the right approach. And I think actually probably perfectly transitions us into what we actually wanted to talk about, which is the LBK Community Program. Do you want to get into that, Katherine?
Yeah, sure.
Okay, tell us about that, would you?
Yeah, so LBK Community is actually one of the first projects I started when I started as health department director I started in 2015. And one of the first people I hired, that was a department of 12 when I started. We're now a department of 80 or almost 80 people. One of the first people I hired was a health educator. We applied for a grant with the Kresge Foundation, and they awarded us $120,000 to look at how to improve the health of our communities. And with that, we kind of pitched this idea of like, well, can we actually make the Lubbock Health Department the convener of all of their different nonprofits and all of the people that are trying to work to address both social and medical needs? So me and her went around, we knocked on doors, met with 30 or 40 different agencies in our community. Nobody knew who I was. It was so hard to get a meeting. They're like, why are you even talking about this? Anyways, long story short, 4 years later, in the middle of COVID, we were able to launch a community network, which is kind of like, it's almost like an EMR. So like kind of how your doctor keeps your medical record on a computer system so that they can see your medical needs over time. This network works kind of for social needs. So it's not sharing medical information, but if a patient or if a client has a social need and say they present at one nonprofit and that nonprofit might not be able to fill that need, they can actually do an electronic referral to another nonprofit in the community to meet that need. And if the second nonprofit's able to meet the need, the first nonprofit that did the referral gets a notice that says, okay, we took care of that. So the LBK Community Network, we just moved to a new platform, so we're relaunching everything. But we have 30 organizations across the Lubbock community that have agreed to work together collaboratively to help address medical and social needs of members of our community. The other great thing about this network is it also allows us to document unmet need. So if somebody needs something, but we don't have a nonprofit in this community that's providing that service, it lets us quantify how many people actually need that service so that hopefully we can go after grant money or foundation money to add those services to our community.
Yeah, it's so, I mean, God, I love this about you. There's the wonkiness of some of this stuff is really where a lot of good can be done and a lot of interventions can come in, because it's like we don't know how to address needs that we don't know we have. And also so many different people are presenting multiple and intersectional sort of needs, and so just having like the records for them to have those, like basically you're making checklists, to get people the types of things that they need, that they qualify for. And so yeah, it's kind of like an underappreciated sort of area that needs intervention, because to the degree that people can slip through those cracks, then the problems that they're experiencing are magnified, then the problems the community is experiencing are magnified.
Yeah, so like if a family, finds themselves homeless and they've been recently rehoused, and they show up at a nonprofit and say, okay, we need help, for beds for our children. And then they go to another nonprofit and they say the same thing. Then you have two nonprofits looking for beds, but we only need one nonprofit to be working on that. The other nonprofit could be working on food assistance, or helping the children enroll in school, or helping the parents find a new job. I mean, you have people could be doing different things to support a family instead of duplicating some of the services.
Yeah, no, I mean, that type of efficiency, and Adam, maybe you'd like to speak to this. Catherine, maybe you'd like to speak to this. This is something that we come back to on the show a lot. It's something maybe we'll get to a little bit later too, because this is such a common theme. Is it's like some things are just gonna have to get paid, and so a lot of public health interventions are about preventing costs down the road that are larger, and so, and as you point out here, like investments in these types of tools that you guys have been able to pull from the city, but also bring in investment from outside entities, helps us realize different efficiencies that also allows our investment to go farther and have more meaningful work. And so I think it's so smart for us to be investing the dollars and expanding this public health capacity that our city has, because ultimately that's going to pay off in dividends in a healthier, happier community, when we start to reap the rewards. Adam, is that?
Well, yeah, that's on target. But along those lines, I would like Katherine, for you to speak a little bit on, so we know that we don't have like a mental health facility here where folks can go for like various types of treatment. Like the closest ones are, I think, are like Big Spring or Amarillo or something like that. Can you talk about maybe why we don't have something like that? What are the challenges to getting something like that? Is anything in the works on that? Can you speak to that a little bit?
A little bit, but a lot of that's more in the purview of, there's a Texas mental health, West Texas mental health, and I'm gonna drop the name. That's a collaborative group that the health department's part of, and that includes Star Care, Covenant, UMC, Texas Tech, the Health Science Center, Public Health in the county, or the city as an entity. Public Health is just part of that, and the county. They commissioned a report that also came out during COVID, so it didn't get as much attention, but they commissioned a report from the Meadows Foundation that is looking at the mental health needs of our community. The health department's involved in the substance use part because that's where we're funded to provide some of those services. But that community group's looking at some different systems to help improve access to care. One of them is a diversion center, which would allow people to be diverted from jail for minor offenses, that they could go to a different center to receive care versus going into the criminal justice system. We've also seen Texas Tech, Psychiatry and Covenant partnered for a new relational healthcare center that's opening very soon at Covenant, that will be for youth. So I think in the next, nothing's fast enough, but I think in the next 2 to 5 years, we're going to see significant increases in the amount of services around mental health that's available in the community.
Awesome.
But that's much bigger than the public health department.
Sure.
All these
Sure.
other partners are coming to the table, and I'm happy that I have a seat and I'm being able to influence some of those decisions.
Yeah, and I think it's important. I mean, I'm so glad you explained that. I know you've told me a little bit about it here and there, but I think it's good for people to hear you explain these challenges and kind of what we're dealing with, so that they understand where this process is and kind of where we're hoping to go. And so that's great. I mean, I think 2 to 5 years is great.
And these big complex challenges can't be solved by any one entity. It's looking at what funding's coming into the community. How can we braid that funding to create what's needed here in the Lubbock community? Because that might be different than, what Dallas or Houston or Austin. We have different resources. We have different deficits than communities, and it's all about filling those gaps so that we can have a full continuum of care.
Right.
So I know we took a little diversion path here maybe, but it just occurs to me could you give me a walkthrough of what, somebody needing a service or what is it going to look like? What is somebody's experience going to be like as they interact with LBK communities? How are they going to move through that? What is that whole experience going to look like? Can you give us kind of a few pathways or an overview there?
Can you guys hear me okay or no?
Yeah, I can hear you fine.
Okay. I'm gonna just take off the video for a second.
Oh, okay.
That's okay.
I think I remember this from the last time. It's
Yeah.
the internet connection in your part of town in this hour.
I know, it's horrible. So, okay. Anyways, I'll just talk. So the experience for the goal with the LBK Community Network is really to have no wrong entry for services. And with that, we want to have our different nonprofits using similar screening tools to identify the social and medical needs of members of our community, and then getting people to the right place at the right time for the right level of care is really the goal with the system. And that's going to take time. I mean, you can't just put on you just can't throw on an electronic system to solve it. It's going to also take, bringing community members together, talking about what happens when someone doesn't get referred, where the gaps are. So with the system, we'll continue to have network meetings. So all the nonprofits that are in the system come together quarterly and hopefully be able to start talking about how we can improve what we're all doing, which also requires us to also look at, what we're not doing well, being willing to admit that, and then being able to make corrections. So it does take a lot of trust.
Yeah, that's interesting. And, some of the projects that we're working on, there's this component for capacity building in communities. And so it's cool that this is not only going to be working to kind of meet people where they are, however they access that point of entry, if that's, through Open Door, if that's through, a nonviolent police interaction, whatever the case is, and they sort of are able to move through this pathway and then get access to other services. And that it's also going to be identifying what capacities we don't have, and likely making it easier to find pathways to build those capacities. Because I see this out there all the time.
Yeah, and I can see that. One of the examples is if a church wants to, start a new mission or, really want to build something, hopefully the data from this, we could tell that church like, okay, we don't need a soup kitchen. We need, this other thing for our community.
Right.
So we can see where we have access capacity and where we can move, people's resources. Because I know people want to do good and they want to do something for members of their community. And hopefully we can get people, let's design the right programs to meet those needs.
Yeah, that's really awesome. I mean, I think that's just it's just the perfect way to do it. I can't say it any other way. I mean, that's pretty cool, and I'm glad that is going on. And so that is the LBK Community Program, and I would like you to talk about kind of the other services that are happening right now at the health department, like what people can get right now that's available to them. Because I was kind of taken aback when I had a meeting with you and you were like kind of letting me know all of the different services that I didn't even know about that are super useful for many people in our community, and they may not even know they're there. So I'd like you to talk a little bit about the services y'all provide now, and then also if you could kind of parlay that into talking about kind of where is the process for the new health department facility that's going to be over on 50th, and then how will that new facility update or change the services that are available. So kind of a lot there, but it's kind of all in the same vein.
Yeah. Okay, so we'll start with services at the health department now. The services that are kind of available directly to the community, there's lots of stuff going on in the background, but big ones, immunizations. Everybody knew that we gave COVID vaccines, but now we're doing, starting to push out more information about childhood vaccines. Hope we have a lot of kids that got behind during the pandemic on vaccines, so we're going to be doing some big vaccine clinics over the summer in coordination with Lubbock Independent School District, but it's open to anybody. You don't have to be a Lubbock ISD student to come get your vaccines, and that information will be coming out. We also have our STD clinic. A lot of people don't like to talk about that, but the health department does provide screening for syphilis, HIV, gonorrhea, and chlamydia, and we also provide the treatment. That's available to anybody for $20. So it's a very inexpensive way, if you're at risk, to get screened and also get treated. And then we've expanded a lot into working with individuals with substance use disorders at the health department. And that's kind of our biggest area of growth right now. We have a program called the Susan program, which is a group of community health workers, so individuals that either have lived experience or have been trained in how to help people address social needs, and they can work with people that are at risk for substance use disorders and help them where they are, and then help them hopefully choose a path towards recovery. And if somebody wants to go into treatment, we're able to fund both inpatient and outpatient treatment for community members who are low income. And we're just seeing that need significantly increase here in Lubbock. And that group probably they have about 700 contacts a month of individuals that they're talking to.
Yeah, I mean, this is such a bigger thing, but like, I don't know, I think it like just has to be discussed because it's so obvious. It's like the elephant in the room, but so many underlying factors related to substance abuse, related to, a lot of the issues that a public health department deals with are in some way or another connected to the material quality of life that people live in. We want to wonder why people need so much more access to mental health services. Well, look at the world we've built. There's a lot of things going wrong in it for people. We want to know why it is that people, why we have kind of a spiking rate of STI. Well, look at the health system that we have built. And so this is why public health departments like your own that are being proactive in their arena, and stepping into that gap are so crucial. They're carrying like such a big weight that our society, that our culture has put on them. And you know, and we're gonna always need that stopgap. But you know, my hope is we start to see some progress in like materially improving the conditions under which most people are living, you know.
And so much of that can be
That's out of
addressed
our
by, I think, proper linkage and community. And that's why
Yeah.
I see the LBK Community Network as kind of a central component of the health department, because it's bringing people together for collaboration. It's supporting community members at the same time. It's identifying future needs.
Right.
So I just think that's having that, and has really become the center of what we do. And we're trying to link every program that we design into the LBK Community Network in some way.
I hijacked that, but how's the new health department location coming along?
Oh, I am so excited about the health department, the new health department location. The one thing I asked for when we built it is I want it to be a place that is welcoming to everybody in our community. It has to be a place that, you know, everybody feels comfortable going into. And I'm just so excited about, like, you'll walk in through big glass doors. It's going to have, I don't know if you've ever been into the current health department, but the ceiling in our waiting rooms about 6, I think Adam hit his head on a pipe, maybe. It's not an 8-foot ceiling, but this is going to have a 20-foot ceiling with, you know, really modern fixtures. And, you know, you'll come in and you'll see like a big open desk with people that are wanting to help you. There's going to be a classroom that holds up to 100 people off the side. There's also going to be a teen room where we'll be able to expand some of our substance use disorder treatment services for teens there at the health department. New clinic space, welcoming clinic space that's going to look like a doctor's office and not just a bunch of junk thrown into a room. New office space. I get a window. I've never had a window.
Nice.
Cubicle space, people won't be sharing. Right now I have people, you know, doubled up, tripled up in offices. So people will have their own workspace. So it's just going to be a great, inviting building. There's drywall up. We get to tour it once a month. So there's drywall. You can see where the bathrooms are going. You can see the front desk space. They're thinking it'll be done in January of 24. With a move-in date, hopefully at the end of February. So if you pass it, you'll see a lot of construction going on there at 50th and U. It's the old Savers Safeway building.
And will there be any new services that you'll be able to add, or will this just be more of increasing capacity for, I guess, the things that you kind of already deal with?
We're looking at, we have in the pipeline a couple of new grants that we hope to get that are federal funding. One is around vaping and tobacco use for youth. So we will have some more education staff that can go into the schools, all the schools within the county, to do some of that education, hopefully give some ways for alternatives to kids going directly into a detention or an in-school suspension, hopefully some other programs available to them, you know, kind of for a first or a second offense. We're also looking at expanding some of our clinical capacity to do a higher level of care, especially around STDs. There's a big need for hepatitis C treatment for uninsured individuals. Possibly some ways to better screen individuals that need substance use treatment. One of the things that keeps people from going into inpatient treatment is not being able to get the medical clearance So hopefully being able to do some of the medical clearance within the health department so that people can access treatment services in a timely manner.
Awesome. And so Josh, before you go on to your next thing, we do have a question from the comments. Kim is
Good.
asked,
That's what I was going to do.
yeah, you were talking about kind of some of the partners that you were working with. And I'm sure it's a long list, but Kim is wondering, who are some of the partners who are already kind of engaged in the Lubbock Community Program?
Okay. Oh, that's a big question. We're doing a lot of work with UMC, really trying to work with their case managers to get that transition out of the hospital, working seamlessly. Other partners, YWCA, Parenting Cottage, a lot of our United Way agencies are coming on board. Some of our churches. I'm going blank. I don't have the list in front of me.
No, it's okay. Yeah, that's
But one of the things I'd like to say to the viewers is that if they work at a nonprofit or a healthcare center, please reach out to us at the health department. We'd be very interested in enrolling your agency. The cost of LBK Community is free for all nonprofits. There's a cost for for-profits. That's how we fund it. So the city and anybody that makes money has to pay a user fee, but our nonprofit entities are able to access and have as many users as needed.
Oh, that's interesting.
Yeah, hold on, Josh, because that's a big call to action there. I do want to reiterate that if you are part of a nonprofit, you're on the board of something that you think would be a great fit for this Lubbock Community Program, you've kind of heard a lot about it here. Share this with the other board members and let them know. I think that the more that people get engaged with things like this, the more efficient we become, the more that we can do, the less energy we use, doubling work and things like that. And so it would be great for anybody to reach out. You couldn't work with a better outfit for sure. Everybody that I've met that has that is a partner to this program or doing anything else with the health department has been amazing. And so if you are doing this type of work or anything that you think that could fit into this program, for sure, reach out to the health department. So sorry, just wanted to get that.
You just read my mind twice. That's absolutely perfect. Catherine, were you going to say something?
No, I was just going to say, we can do demos with case managers in the community. There is an MOU that's required to be signed. There's confidentiality agreements, all of that legal stuff can get worked on. And if you reach out to the health department and ask for Sadie, she's our go-to person for LBK Community, and we're expanding. So she's going to be a 2-person team. In a month, I got funding for a public health fellowship. So we have somebody that recently graduated from public health schools and will come work for us for a year, fully paid by the state. And they'll be working with Sadie on onboarding agencies, going out and doing the trainings and kind of reviewing the data and giving feedback to people.
Yeah, no, I think you guys said it so perfectly. It seems like this could ultimately build to a really long list of different providers, both in the nonprofit and the for-profit space, that really makes it easy to network people together. And just backtracking. Oh, go ahead. No.
One of the great stories we had a local church that had some funding for utility assistance. They were able to onboard onto the network very quickly. They were able to get referrals and spend down that money. But then when they were done, you can just uncheck their box and it says nothing's available from them right now. And then if something happens again, they can come back to the network and use those funds. And you can also know real time if an agency's grant ran out and you're not making a referral. Like, I hate the idea when you send somebody and go give them a list and say, oh, call all these places. And they're like, oh, well, this doesn't exist anymore. The network lets us keep up to date based on funding streams and budget years of what's available.
Wow.
Quick, Josh, Sarah had a question. Sarah, the program that we're talking about is called the LBK Community Program with the Health Department, and it's about community partners and organizations getting connected with the Health Department to address various needs. And you may just want to watch the video back. I'm not sure when you jumped
But
in,
it's
but
a
that's
social service linkage and referral system.
yes.
Yeah.
That's the best way to say it.
Okay.
Yeah, no, and just backtracking one bit, I think it's going to be really cool when the new health department spaces open up, because I think the aesthetics of the building are actually like really important, because healthcare can be uncomfortable and awkward, and having a beautiful space to be in, something that is inviting, is gonna make people want to actually go through this. A lot of this is multiple stages or doses of a vaccine, a course of antibiotics. And so you want people to, have that time be comfortable and inviting and welcoming. And so, as soon as the doors open, I'm going to come down and let you update some shot for me and whatever else you want to do for me.
Well, I hope we have a great, big, grand opening, and, I want people to feel that they're valued.
That's wonderful.
And I want them to walk into a space and know that we do care about them.
Yeah.
That's the thing, because that's so needed in the Lubbock community. And I talk up our community as much as anybody, but we do definitely have a lot of issues when it comes to inclusiveness, especially from some places where you wish it wasn't coming from. And so for the health department to be leading with inclusiveness and making sure that it's a safe space for everyone in the community, I think that needs to be honored. So just wanted to say that real quick. Go ahead, Josh.
Big shout out. No, I was just going to ask Katherine if there's anything else that she wants to make sure and share with people, or uplift, or tell people how they can connect with this program or her work more broadly. Just the floor is yours.
Yeah, well, I will need to say something about COVID. I said at the beginning I wasn't going to, but we saw that, the World Health Organization last week ended kind of the public health emergency. The Biden administration just ended that public health emergency. That doesn't necessarily stop our local work around COVID. And I just want the community to know that just like we monitor flu and other viruses and diseases, that we will always be keeping a watch on what's going on with COVID. Like, we don't report numbers every day or every week, but those are still collected. Thankfully, we go days without having a reported case. And at some point, we might have a variant or a change that would, require either, recommendations of updated vaccines or recommendations of masking and social distancing, even though I don't ever want to go there again. But I just want people to know that a lot of that work that happens in the health department behind the scenes is that monitoring and watching out what's going on in the health of our community.
Yeah, no, such valuable surveillance you guys are performing on this area, and keeping us safe and healthy. We really owe you such a debt of gratitude for everything you've done to this point and everything that you hope to do, Katherine. Adam?
Yeah, just thank you for coming on here and sharing your insights and your wisdom. This is the stuff that people need to hear. This is literally why we made this show and why we continue to do it. I think this is going to be a great resource for people. Thanks for coming on. And that's all I have.
Sorry about my poor internet at home that always messes up, but
that's it. Well, we're going to check back in on this internet situation at least by next year, maybe sooner. Come back.
I'll tell my husband to fix it.
Yeah. Anytime you wanted something to tell us, you know you've got an open space.
Well, I appreciate you all, and thanks for having me on. And I'm not going anywhere, so I'll be here watching Lubbock for a while. So
Very good.
Well, thank you.
All right, thank you. I'm gonna sign off. Take care.
All
Bye.
right. Good night.
Adam, I think we
Yeah.
ought to do the community resource spotlight, and then I think we ought to do the announcements. And then next week, I think is the show to us. You know, we had a city council meeting this week. There's some things I think we could talk about. But I think we can do most of it on the show next week. There's nothing that's that urgent to share with anybody.
All right. Well, I'll get right into the community resource spotlight. Perfect for this episode. We've been talking about health and health resources. And one, I got to say, is an underestimated resource. I learned so much about this organization in the last year, but it is Planned Parenthood of Greater Texas. And Planned Parenthood of Greater Texas offers a whole host of services. And they also do this. They have income assistance. So if you're low income, if you can't pay, you can tell them that, and it's no questions asked. If you can't pay, you just can't pay, and they will still give you care. And the various types of care that they provide are many. And so the Lubbock Planned Parenthood Health Center is located at 3716 22nd Place. And they, like I said, provide a variety of health services to people of all genders. And so essential healthcare that they provide, including emergency contraception, birth control, annual exams, breast and cervical cancer screenings, STI testing and treatment, PEP and PrEP HIV prevention medication, and more things are available via their telehealth appointments. And so you can also, like I said, can qualify to not pay or just pay what you can. And so great community resource. Also, something that I think is kind of a misunderstanding a lot of times is that Planned Parenthood services are not only available to females, you can be a male, and you can get services there for various things. And so it's not only for females. And so just wanted to put that out there so people know. Empowerment kits are also available to patients at the health centers at no cost. And there's various things in the empowerment kit that could be useful for folks out there. And so a lot of people don't know how long Planned Parenthood has been around. They've been around for 85 years, and they provide quality care. It's not, just because you're not paying for it doesn't mean it's not quality. It's quality, compassionate healthcare from expert clinicians, medically accurate, inclusive sex education from professional educators, and enduring commitment to restoring and expanding access to healthcare for communities who need it most. And so if you do have some healthcare needs in these areas, you can make an appointment with Planned Parenthood by calling them at the local Planned Parenthood here at 806-696-3436, or you can go online and actually make an appointment online, and that's at plannedparenthood.org. And so a great resource out there, and it just fits perfectly with this show. So
Yeah.
That's it, Josh.
Folks, you're not going to want to miss next week's episode, okay? We're going to want to talk about this city council meeting. There's some topics we want to open up for the audience, like we talked about last week. We want to dig down into the weeds with you and hopefully keep it at least entertaining enough that you want to stay here with us. But I got some things to talk about next week, so I'm glad it's just you and me. Announcements. We want to make sure and remind folks that the neighborhood planning meetings are having their next session. That is tomorrow from 6 o'clock to 7 o'clock. The Dunbar Manhattan Heights meeting will be at May Simmons Community Center, and the Jackson Mahon meeting will be at Living Word of Faith, like community room. So that's 6 o'clock to 7 o'clock tomorrow afternoon. If you have been following this process and want to attend one or either of those, tomorrow is the next time that's meeting. And then the other thing we wanted to make sure and bring to people's attention is that the city is having a public hearing, or kind of more just like a public meeting. I think it's just open public forum in Citizens Tower tomorrow regarding what to do about Broadway and the bricks. I know people have a lot of feelings and opinions about this. And so if you're one of those people who is, you know, a directly concerned stakeholder, a business owner who's connected to this, somebody who lives there, somebody who's interested in historic preservation in our city, or just somebody who has strong opinions, your presence is requested at the public meeting at 5:30 tomorrow at Citizens Tower. So a lot of going on in the community space tomorrow. Pick your poison. Hope to see y'all there. You want to close it out, Adam?
Perfect. That's it. That's all we got for this week's show. Thank you, everybody, for tuning in. Please reshare this. Lots of great information, very useful to folks out there. So please share this video far and wide. This is the point where I remind you to join your neighborhood association so that you are never behind when they do a neighborhood plan or something cool in your neighborhood. And you can also advocate for your neighborhood through a neighborhood association. So that's why I remind people every single week to join your neighborhood association. I don't know that I've explained that ever, but that's why I do it every single week. So do that if you can. And otherwise, check us out right back here next time. See y'all later. Good night.
Bye-bye.